Hi, my name is Joel Novak. I'm a physical therapist and certified strength and conditioning professional. And I'm here to talk to you a little bit about BFR, blood flow restriction training, and answering your questions and help you understand it better or learn a little bit more about it in order to either help your clients or to help yourself. Blood flow restriction training is a rehab, intervention, and performance enhancing tool that taps into the body's natural systems of stress and recovery. In other words, you're exercising working muscles in a state of limited blood flow and blood circulation. Our bodies are engineered to manage and handle the stresses that we place upon them. With blood flow restriction training, basically what you're doing is you're restricting the blood flow to the working muscles. Therefore, less oxygen is getting to the muscles. We all understand that our muscles need oxygen so that they can work. With blood flow restriction, you're going to get tired faster, fatigue the muscles more readily, and that's what leads to growth and development of those muscles. Hypertrophy, gains in size of the musculature itself, happens with blood flow restriction at a much lesser intensity than with traditional exercise alone. The number one question I get all the time about blood flow restriction training is it safe? Because it doesn't sound safe. And honestly, when I first heard about it, I thought it sounded ridiculous too. Then I read some studies, then I read some more studies, and now there are hundreds of studies published on blood flow restriction training. And it is safe across the board. It's ultimately been shown in the literature to be safe in multiple studies. Blood flow restriction training has been utilized safely in elementary aged individuals, athletes, post-surgical patients, and even the elderly and heart condition patients. The bottom line is, what makes blood flow restriction training safe is that you're not fully cutting off blood flow. It's not a tourniquet that's used in surgery that just fully cuts off the blood flow and you exercise with it. It only restricts the blood flow. It modifies the blood flow, which just makes exercise harder. Therefore, we can make gains, but it is ultimately very safe. The other question I get is, what about the vessels? Aren't they being damaged? The veins and arteries, aren't they being damaged by the compression of a band or a cuff around your arm? And the answer is, not when done properly. In fact, your body releases something called vascular endothelial growth factor, which I know is dorky, but ultimately all that means is the lining of your smooth muscles of your vessels are actually working out too. They're actually exercising, in other words. So your blood vessels are actually improved. Their flow, their size, even new development of blood vessels called angiogenesis happens with blood flow restriction training as well. So not only is it not unsafe for the blood vessels, it's actually a good thing for them. One of the biggest questions that I get is, does blood flow restriction training work? The bottom line is yes, and not only for athletes and fitness populations. As a matter of fact, most of the research is done on the elderly, injured populations, and post-operative patients. There are hundreds of articles out there on blood flow restriction training, and it's shown to increase strength, increase muscle size, so muscle hypertrophy, minimize or mitigate atrophy, stimulate bone growth and healing, and even improve some function measurements as well as pain reduction. So yes, blood flow restriction is not only effective, but it's effective across a huge span of patients and individuals utilizing blood flow restriction training. So at this time, the research supports a large variety of populations, so different ages, various health and medical conditions, and different abilities can all benefit from blood flow restriction training. Why? Because blood flow restriction training works just like exercise works as far as the physiology in your body. Again, you're only exercising in a limited state of blood flow and blood circulation, but ultimately you're tapping into exercise just like you would traditionally. Now, blood flow restriction training has been shown in hundreds of publications to be safe and effective, utilizing different bands, different cuffs, different sizes, different pressures. So a question I get is, if they're all effective, can't I just wrap some tubing around my arm or a belt around my arm and do the same thing? And the answer to that is honestly no, that is not ever recommended. Even having a baseline of pressure to start with, something that you can regulate the pressure that goes into a given device or apparatus. Again, even if the range is large, that is effective and safe, too much pressure, you run the risk of fully occluding and fully shutting off blood flow, which is dangerous. Too little pressure is you're not going to get the benefits of the actual restriction, and so therefore it's not going to be very effective. So I always recommend using a device that you can control the amount of pressure that goes into or out of the band to make sure that you're safe and effective.